Hello, everyone, and welcome to the sixth module. This is also the second last module in our series of medical writing course. So, herein in this module, we will talk about two things. First, evidence, and I mean the evidence which we try to link our scientific research with, and two, data in the scientific research, how to handle this data, how this data is relevant to a medical writer. So I have tried to structure this module under four sections. The first one, wherein we will talk about the scientific medical databases and collecting the evidence. Then we will talk about decoding, strategically reading the scientific paper in a way that we are able to decode the information present there. Third, we will talk about the data, how to demystify it. And towards the end, we will talk that how important is ensuring the accuracy of a research paper is. So everything, whatever is going into a research paper needs to be referenced and supported with the authentic scientific data, right? So now coming to the first section, which is finding the evidence. See, when we say finding the evidence, what exactly we mean? Uh, so, for example, you have received a paper, a scientific research paper on treatment of heart failure. So, instead of going ahead and reading that paper, what you should do ideally, ideally you should try to find out at least 7 to 8 good literature papers already available around your area of interest. So it would be helpful in this case. So uh, uh, collecting the literature. When we say evidence, we mean collection of existing literature in that particular field. So we must use authoritative evidence-based sources, and the database which we refer to must not be Google, as we have discussed in our earlier modules also. Primary tool is still PubMed, which is mandated by the US National Library of Medicine. It is still the first stop for almost any literature search. However, not just rely on PubMed. So again, going to the same example of treatment of heart failure. Once you receive some such paper, try to find out some 2, 3 good papers from PubMed and also from other authentic scientific databases such as Cochrane Library, such as Embase and clinicaltrials.gov. Now, you have okay, so while you are trying to find out these research papers, just don't write heart failure. Instead of writing heart failure, try to make it more relevant medically. So what we talk about is like medical subject headings, the mesh terms. So instead of heart failure, if you are writing myocardial infarction, you will get more relevant, more scientific literature available in the field. Likewise, another technique to make your search more smart is to use conjunction words, which we call as Boolean operators, in a smart way. So, there are these three terms, and or not. So, you should know to use them smartly. For example, if you are writing migraine and women, it will narrow down your search. If I am writing myocardial infarction and HFpEF. So it will narrow down my search to bring out the results of, I mean, the treatment options in HFpEF, variety of MI, right? Uh, at the same time, if I'm writing or if I'm using or, so for example, obesity or overweight, it will give me combined results for if, one of those papers may talk about obesity, the other paper may talk about overweight, right? So it will broaden out the search. And now when I'm using not, so for example, cancer, not lungs, then I will find all the results other than the lung cancer. So you should know to search literature smartly. Now coming to the second part of the module, how to read a scientific paper. See, we have already discussed this in earlier modules that there is a fixed structure which a scientific research paper follows. We follow an MRAD structure. I is an introduction and methodology, results and discussion. But this is not the sequence. This should not be the order in which you as a medical writer is reading that paper. Okay, so you have to develop a sequence of reading by which you are able to extract as much information as is possible from that scientific research paper. You should be able to use your skills aptly to decode that paper. So instead of following the SIMRAD, the sequence which we need to follow is first get an introductory idea, get a no, not an introductory. It can mislead you. You need to get the summary, the gist of the paper. So first read the abstract, followed by abstract. You need to know the crux of any scientific research is in the section on discussion. So discussion will give you an idea of what the researchers were thinking, what they thought, what they derived after getting the results. So, abstract followed by discussion and conclusion, and then come to the introduction. By introduction, because introduction will give you the idea of the existing research, the previous researches that happened in the area, and then go ahead and read the results to get a clarity on the data points, and then finally towards the end read the methods. So now see, some papers are 20 pages long also. So by reading a particular section, it is humanly impossible. Even for an AI, it's impossible to remember all the points, right? So you have to know the key areas where you need to focus on. Okay, so when you are reading the method section, focus on these 3 points. What is the study design? Is it an RCT or it is an observational study? What was the inclusion and exclusion? What were the criteria used for allocating the population in that particular study design? And what were the endpoints that were being measured? So read the entire results section, and after reading it, note down these 3, 4 key points. Likewise, when you are going through the results section, see, there is nothing which is subjective in the results section. Everything is a data point. It is a numerical value. So just that doesn't need any interpretation. Okay, so just it is completely factual. So just write down about the the tabulated points. Okay, when you come to the discussion section. Discussion section is completely based on the author's understanding, on the author's interpretation of the result data points. Okay, so what exactly you need to focus on while reading the discussion section? Again, 3 points. First, what was the hypothetical research question which this paper was designed to answer to, and does the results section is answering that particular hypothetical question? So this would be your first point. Second point, what was unique in this study wherein the previous literature failed? Okay, so what factors this study was able to consider, but not the previous studies. So the novelty, the second point, and the third, limitations of this study. Again, limitations become very important for your peer review, peer researchers. They must be knowing about the limitations which your study faced, so that future researchers can take care of those factors and go a step ahead, right? Now, coming to the third part, demystifying the statistics for writers. See, we cannot be the statisticians. So, there may be figures which may not make much sense to us as medical writer, but as a medical writer, we should be able to interpret certain understand and interpret certain terms such as p-value, such as confidence intervals. So, I have just covered two of these terms, the p-value and the confidence interval. There are many more available for which you can refer to the literature. Okay, so p-value, I would simply say the way how I memorized it, it is inversely proportional to the result. So if a drug uh, has some value, has some uh, 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 if it is effective in a particular disease, then certainly its p-value will be lesser as compared to another drug which is not showing any effect in that particular disease condition. So p-value is inversely proportional. But definition wise, p-value is the probability of observing the study results if there was truly no effect. So actually it means the same thing. Okay. So I mean, based on all the studies, the researchers have derived a cutoff point. So if the p-value is lesser than 0.05, then the result becomes statistically significant. Talking about confidence interval is directly proportional. So if a particular drug falls within a range, it means that you can be this much confident that the particular drug is showing effect. Okay. So, and yeah, one point of difference, whereas the p-value would simply tell you ki haan, it is statistically significant, whereas the confidence interval will give you an idea about the magnitude, about the precision of the result. Okay. So, uh, I mean, yeah, so it can simply p-value can tell you a yes or no, whereas a confidence interval can give us an idea about how much. Okay. Now coming to the difference between being statistically significant and clinically significant. So a value which is an effect, result endpoint which is statistically significant, many a times it may not be clinically significant. So if I am talking about a drug X in in a researcher's study, and p-value and confidence interval and everything, the conclusion says that it is statistically significant. The drug was showing effect in this population cohort. But if the patient is not perceiving the effect of drug uh, to I mean to a significant extent, then the drug becomes clinically insignificant, right? So now this also we have discussed in earlier modules that based on the study design, the data referencing and I mean, the data support, the data evidence is different. So, whereas for a clinical case and or expert opinions may be based on a particular clinician's own experience, own practical experience, and it may not be that particular document may not be very data heavy. But if we are talking about, on the other hand, if we talk about meta-analysis, it would be strongly data supported, strongly data driven, right? So now the last part of the module, which is ensuring accuracy. So see, as a medical writer, your responsibility is to ensure that whatever data point, whatever fact, whatever statement goes from your end into that document needs to be authentically supported and referenced to a scientific source. Okay, so I mean, many at some places, I mean, there are some documents such as meta-analysis also, and yeah, and some other original research articles also that ask for line by line referencing also. So you have to ensure that every single data point or a statement or reference in your document must be checked against the source material. So whatever is already there, already referenced there, please go ahead and check it, because this is the era of AI, and AI is too good at hallucinating the references. So please make it a habit of validating, of verifying every single reference which is mentioned there. Now talking about annotation. So what exactly is annotation? Annotation is nothing but the process of linking every claim in your document to its original source. Okay. So ideally, how should it be done? So this is your content document. So every data point, wherever you see there is a data point or a factual statement, you have to maintain a parallel Word document wherein you will add in your comments with the source name, page, and paragraph table number. We call it as reference pack and reference binder. Okay. So this will give other reviewers a confidence that everything which is going ahead is scientifically supported and referenced properly. Again, talking about reference managers such as Mendeley or EndNote, please make a habit. Please get an expertise on these tools, right? Also, you should be clear on the style of referencing which that particular task is requiring. So now, if it is Vancouver, it should be Vancouver all across. If it is AMA style of referencing, it should be AMA for all the references in that particular document. So with this, we come to the end of the module. 3, 4 key takeaways. First thing, please rely on authentic, authoritative databases such as PubMed and Cochrane Review. Search smartly using Boolean operators and mesh terms. Develop a particular smart sequence of reading and interpreting a scientific paper. Now, a value which is statistically significant may not be clinically significant, and do ensure that whatever facts are going from your end are supported scientifically and appropriately referenced and documented. So thank you. Please stay tuned for the last module of the series. I will upload it shortly. Thank you. Take care. Bye-bye.